Hello, Assalamu alaikum. In this video, we will understand about the type 2 diabetes. It is 90% throughout the population than the type 1 diabetes. So, in this video, we will understand the type 2 diabetes. It will occur mostly after the 40 year in the person. So, when food and sugar containing food intake go into the digestion, will lead to absorb into the blood and rise the glucose will trigger the beta cell of a pancreas to release insulin. Insulin bind with a specific cell like myocyte and adipocyte as well as hepatocyte, and to open the GLUT4 channel to influx of the glucose will lead to normal level of the glucose in the blood is known as the isoglycemic index, isoglycemic effect. So in this way the hyperglycemia to isoglycemia and sometimes the hypoglycemia will occur. We will discuss how. This is the normal physiology. Let's understand about the more preference of the insulin in the tissue. This is the pancreas. Beta cell produce the insulin and go into the blood circulatory system. When the glucose rise, the rise of the glucose will trigger the beta cell. By the mechanism we will not understand in this video, but just you can understand that as well. So in this way, the when sugar will intake through a beta cell and the calcium will move inside to trigger the exocytosis of the insulin vesicle. This is the glucose and this is the insulin when bind with the muscle. So muscle prefer more for healthy person, and the exercise and other fasting mechanism will lead to increase the muscle cell containing insulin receptor. Saturation of insulin receptor will increase, will lead to GLUT4 channel will open more to glucose move inside to produce ATP and glycogenesis. That is why the muscle builder, the bodybuilder will increase the muscle due to this glycogenesis formation. Insulin here is will bind with the hepatocyte after the muscle. It will more preferably, and in this way glycogen formation through GLUT4 channel open, while the adipocyte is the last one. After the more resistance in the hepatocyte and muscle, the adipocyte will prefer more glucose, and in this way the adipose tissue will develop more. It is pre-diabetic condition. The diabetic muscle is basically the GLUT4 vesicle will not bind with the plasma membrane due to the insulin resistance because the receptor damage of the insulin receptor damage. In this way, the glucose will high in the blood will lead to hyperglycemia. So the cause of the type 2 diabetes is the lack of exercise, bad eating habit, non-fasting, and no fasting, and the simple sugars and genetic mutation like aging. Anyhow, this is the insulin receptor, and the insulin receptor transcription factor will lead to polymerase enzyme work for the transcription to translation of the insulin receptor protein. Epigenetic and genetic mutation will lead to disrupt and change the DNA sequence, will lead to cause the insulin receptor resistance and further own damage. The insulin resistance will lead to diabetes mellitus too. And in this way, let's understand about the whole story, how it will progress from pre-diabetic to the insulin resistance will lead to diabetes mellitus. The pre-diabetic person is basically the pancreas work normally, and in this way the some receptor will work in the muscle but the some will not work. So in this way here you can see this is the basically this is the receptor, and in this way this is the fat, the adipocyte. Glucose will enter more into the adipocyte due to the insulin prefer more rather than the muscle because the pre-diabetic person. In this way the fat will develop, will lead to hypoglycemia will occur sometime due to the more glucose will move inside, while the lead to hypoglycemia and polyphagia to obesity will occur. Due to the polyphagia, due to the low glucose level again and again, because the adipose tissue will absorb more glucose rather than the normal level. And in this way, the adipose resistance will again occur after the using again and again this insulin receptor due to the polyphagia. Polyphagia means again and again eating and will lead to obesity. And in this way, the adipose site will develop more, is known as the lipogenesis. And in this way, the adipose resistance will occur. The insulin resistance more in the adipose tissue will lead to again more hyperglycemia and hyperinsulinemia. In this way, the insulin will rush more and the glucose will rush more, will lead to urinate and will require the water. So the water absorbed from the tissue and the polydipsia will occur more frequently, water drinking. And in this way the urination will more, and that urination is the basically the for dilution the water required for the excretion of the sugar, and the polyuria will occur. This polydipsia and polyphagia basically will occur, and in this way the again and again water intake will lead to excretion of the glucose through water, lead to also loss of the calcium, potassium and other electrolytes, and will lead to dehydration, hypokalemia and hyponatremia, will lead to cause heart failure and neuropathy and fatigue. In this way, the electrolyte will be disrupted, and the loss of the electrolyte, on the other hand, the loss of water will lead to absorb from the tissue, and other polydipsia mechanism will lead to cause many problems. Anyhow, in this way here is you can see this is the lipolysis will trigger due to the hyperglycemia will already present, but remember that things basically you can imagine that here is the muscle cell. So in this way the glycogenolysis will occur due to the breakdown, and beta oxidation will occur, will lead to also increase the blood glucose level, and the liver will also glycerol and free fatty acid consumed to produce low density lipoprotein. And the glycogenolysis will occur already, glyconeogenesis and ketogenesis and beta oxidation will occur. This is the catabolic action will lead to weak the body. Metformin is the tablet, is the medicine, glucophage, will enhance the insulin-like growth factor 1 autocrinally. Bind will lead to influx of the glucose for normal metabolism. So the metformin, thanks from the metformin for normal metabolism. The constricted urination will lead to damage the glomerulus of the nephron, will lead to cause the kidney failure, renal failure or. So the glucose level will still high, and the fat loss will trigger more and more, and gluconeogenesis will occur in the liver to produce more glucose from the free fatty acid, and the low density lipoprotein will increase. LDL will increase, will lead to fat loss and fatigue and nausea, because the LDL is used as energy for production of glucose, but that glucose will be ultimately urinate. So all things will be urinate due to the glucose problem, due to the insulin receptor problem, is known as the diabetes mellitus 2. In this way, in the blood vessel, if we will focus more, so the basically glucose will prefer, and without insulin receptor, the GLUT1 channel will absorb the glucose when increase the more glucose in the blood is the co-transporter, require the sodium, and will lead to produce more ATP through glycolysis, and the mitochondria is used to create the inflammation due to the more ATP and increase the reactive oxygen species. And the cytokines production from the endothelial cell of the blood vessel will lead to recruit the monocyte. The recruitment of the monocyte, here is the bigger picture of the tunica intima, media, adventitia, and lumen of the blood vessel. This is the endothelial cell, and this is the RBC. It is the inflamed and damaged endothelial cell will lead to LDL more move into the tunica intima, and the LDL particle will move more, and due to the endothelial dysfunction it will be deposited in the tunica intima, and the tunica media contain a smooth muscle layer. while the tunica adventitia contain a mast cell, an innate immune cell, and the external and internal elastic membrane between the smooth muscle tunica media contain and nerve and blood vessel containing tunica media. This monocyte will bind with the adhesive molecule with the endothelial cell due to the recruitment through cytokines to move inside where the endothelial dysfunction. In this way, between the two endothelial cells, the macrophage will move inside. And in this way, the endocytosis of the LDL, which that is depositing in the tunica intima. And in this way, the macrophage basically convert into the macrophage foam cell, and ultimately the dead of the macrophage will deposit the LDL in the form of plaque formation. And in this way, the endothelial cell will stable due to the growth factor. Vascular endothelial growth factor and other growth factor will lead to stability of the plaque. And in this way, the plaque formation will occur. And you know that the collagen formation due to the growth factor will lead to stability, and to increase the size of the plaque will impede the blood flow. And let's understand about the development of plaque and thrombosis formation. This is the normal, no any problem for the development of plaque and thrombosis in the early phase of the coronary artery or arteriosclerosis. So, in this way, this will lead to become a arteriosclerosis due to the damage of the blood vessel, due to the hypertension as well as the endothelial cell more uptake of the glucose. In this way, the coronary artery or other side will develop gradually, required more time for development of the plaque and stability of the endothelial cell, and scar tissue formation will occur. Ultimately, the blood flow require more pressure to rupture this thrombosis, and weak due to many causes lead to heart attack if the coronary artery disease or other factor and other problem, and that will lead to cause many problems, and it is known as the arteriosclerosis. And sometimes the arteriosclerosis will occur due to the type 2 diabetes. This was the overview of the pathophysiology of the type 2 diabetes. Thanks for watching. See you in the next video for this. Bye.